Hello, everybody, and welcome to this week's episode on Fit as a Fiddle. Our guest today is Paige Bellenbaum. She is an LCSW and the founding director and chief external relations officer at the Motherhood Center, which is an amazing, amazing place and community of humans that support mothers and all the things that go with that, emotionally and mentally and in so many ways physically too, because those things are all related. Paige was on our podcast in 2020, which was a long time ago, 4 years ago. And at that time, I did not have a child. And so we were just talking about how she was talking to me so much about, what are PMADs and what does that mean? And when is it just baby blues? And, the title of that show, for those of you listening who want to go back, it's called A Sad Mom is Not a Bad Mom. If you just search that on Fit as a Fiddle, those were words like almost directly from Paige from the episode. And so today what we're really touching on is what has evolved in the last 4 years. So much has happened in the world, so much has happened in this country, so much has happened in New York City, where we both are, in terms of just what it is to be a mother. And so we're just going to be touching on all of these things. And Paige is the expert on this because she writes presentations and does keynote speeches. And really, her whole time and life is dedicated to this. And as a mother of two, she has so much experience working with her own children and so many other families and helping them overcoming postpartum anxiety, depression, and other mood disorders. So we're really lucky to have you on the show today, Paige. Thank you for being here.
What a pleasure to be here and what a lovely introduction. And I can't believe the last time we did this was 4 years ago, like right around the pandemic, and how different things were, and
Mm.
how excited I am to have today's conversation because a lot has changed in the field of maternal mental health. And I'd love to be able to bring all of your listeners up to speed.
Absolutely. Okay, so let's first just dive into a little bit about what you're up to. You and I just caught up about it, but I'd love the listeners to know, what is your role, what are you doing on a day-to-day basis, and what your wonderful work is.
So I have the honor of working very much at the Motherhood Center of New York. And we opened our doors back in 2017. And we are, as many of your listeners might know, a clinical treatment facility for pregnant and postpartum people experiencing what we refer to as perinatal mood and anxiety disorders. The acronym for that is PMADs. We don't love it, but it's what we have. And it's what most people know of as quote unquote postpartum depression. So we offer support groups, we have perinatal therapists, we have reproductive psychiatrists that specialize in medication that is safe and effective to take during pregnancy and the postpartum period. And we have something that doesn't really exist anywhere else on the East Coast, which is a day program or a perinatal partial hospital program here in New York City with an on-site nursery, and women and birthing people join us virtually or in person for a higher level of care. So these are women that are really struggling to care for themselves and their baby and need more wraparound support to get better. And so what I've been doing is all of those things. Working with a wonderful staff of over 50 people, clinicians, and administrative team to really make sure that we can help pregnant and postpartum people feel better and recover from maternal mental health conditions. Because the good news is there's a lot of hope, and with the right support and treatment, everyone can get better.
And I love that. It's exactly true, is you need the support and you need the treatment. And then where does that all come from is access. And where does that all come from are the clinicians that work directly with these pregnant and postpartum folks to send the right referrals, or for people to just know that this exists and from word of mouth or whatever it is, and then come to you directly. So that's something that's really interesting. And I know we've chatted about this in the past, just about access and how tricky that can be, and how much you've done work in just the political realm and helping bring that into light some more. So maybe you want to just touch on that before we dive in.
Yeah, 100%. I'm a social worker by training, and one of the things that I love about social work is We cover the gamut in training and practice from micro to macro and everything in between. And that means that as social workers, we work with one individual at a time, a family at a time, a community at a time, all the way up to impacting public policy, working with government agencies to really impact meaningful change on a macro level. And so I've had the opportunity in my career, which I'm so incredibly thankful for, to do all of that and everything in between. And I will say, currently, I'm very involved in many different government initiatives that really aim to have a vaster impact on pregnant and postpartum people in throughout the lens of maternal mental health. And it's been, yeah, it's where my heart is at. It always has been, and the good news is there's a lot going on right now.
Yeah, I was just gonna say, so this is recorded in August of 2024. So you will be hearing this in a couple of weeks from now, but we are in an election year that is very heated, to say the least, and has quite a few implications for just childcare support and maternal support and just general reproductive rights and perinatal rights, right? And so it's really interesting. I want to hear your thoughts on how the election and politics and who's in power can change specifically the work that you guys are doing.
These are all great questions, and I'm going to answer that. And I'm going to take us back a couple of years as I get to that particular question. And one of the things I want to highlight is, I've been working in this area for almost 20 years now, and there are those whose shoulders I'm standing on that have been working in the field of maternal mental health for much longer. I will say for the first time in history, I've never seen so much action and commitment and attention being placed on maternal mental health. And the primary impetus for this sea change and shift really had everything to do with some CDC findings around maternal death in the US. And as you might know, and as many of our listeners might know, tragically, the United States has an incredibly high maternal mortality rate, the highest in any developed country. And what we learned about 2 years ago, or what finally received attention about 2 years ago, was that mental illness and substance use are the primary contributing factor to maternal death in this country. And it is when perinatal mood and anxiety disorders and maternal mental health finally made the front page. And it's when people started listening, when people started recognizing that in the most painful of tragic situations, women were losing their life to a maternal mental health condition. And as a result, we've really seen a sea change on all levels of government. We have the federal government that just recently released their maternal mental health blueprint that spells out all kinds of recommendations around providing public awareness pertaining to maternal mental health, implementing high quality screening initiatives to be able to routinely screen for perinatal depression, anxiety, and the other perinatal mood and anxiety disorders, looking at really innovative best practices and programs when it comes to providing support and treatment to new and expecting mothers and birthing people experiencing these illnesses, and really a focus on doing better. There's been money that's been trickling down from federal organizations like SAMHSA and other government entities. Here in New York State, I have had the honor of sitting on and continue to the Maternal Mental Health Task Force, which has been assigned to develop best policy and practice around maternal mental health here in New York State. And I also, Sneha, just came off a 2-year term here in New York City serving on the Maternal Mortality and Morbidity Review Committee, which was a very difficult and very necessary position to sit on, especially through the lens of maternal mental health. So we are seeing all of these levels of government really pay attention. And so what that means is there's more money available for groups and entities on the ground to begin looking at innovative ways to support pregnant and postpartum people through the lens of mental health. And it's really been just a super exciting time to see such commitment. I'll give you an example. Just 2 weeks ago, I was presenting at a conference at Postpartum Support International, PSI, and they are the epicenter and godmother of perinatal mood and anxiety disorders. They opened back in the 80s, and they have become so incredibly powerful in the best way through the lens of support, education around maternal mental health. They have a directory of providers all across the world that you can go to for support and clinical care. And I was there presenting, giving the keynote on higher levels of care, like our day program here at the Motherhood Center. I remember back in 2014, the first PSI conference I ever went to, there was about 300 people. This time there were 1,300 people. They had to close registration. They
Wow.
sold out of the hotel. This just gives you a sense of how much more prevalent this issue finally is.
Wow. So many things come to mind. One, you're a force of nature. Two, don't smile because it's just true. Take the compliment because it's just so true. Secondly, I'm so sick of the whole maternal health space being so under-recognized and underfunded that this is like a shock to me to hear this, because I guess I kind of knew it in the backdrop on like different things that were happening on social media and stuff like that, but I haven't like delved into the politics in this subject matter the way you have. So it is alarmingly positive and shocking, and I'm so happy. I'm like, "Oh, finally." I mean, we're all like freaking finally, right? But thankfully we're getting into that space where this is spoken about more, and we're, I think at the end of the day, if you speak about it more, there's money for it and then there's solutions for it. I feel like that's how the world works usually. So, and it's like people like you who are speaking about it, speaking about advocating, and then finally the needle turns. And so that's the second thing, is just commenting on the amazingness of that happening at this point. And then the third thing that comes to my mind is, what's the goal? What do we need to achieve? What in your mind would be like, and if we had unlimited support from the government and private sectors and people and non-mothers, especially in this world, what would be the ideal situation in Paige's brain of like how this should work in America specifically, because we're the ones with the problem?
So I should say, as I mentioned, I've been doing this work for almost 20 years now. So my excitement about the fact that people are actually paying attention to this is not meant to suggest that we are anywhere near where we need to be,
Of
right?
course.
Like, I'm just saying, like, people are talking about it finally, right?
Yeah.
So I'm enthusiastic because, on a scale from 1 to 100, we went from like 1 to 10, and that is progress. So we got a long way to go. So I appreciate that question. Yes, there is some money trickling down. Is it enough? Oh my gosh, it doesn't even scratch the surface. So what is needed is a fundamental focus and priority on generating funds to really be able to replicate successful programs that are effectively treating pregnant and postpartum women and birthing people that are experiencing perinatal mood and anxiety disorders. We have a workforce shortage in the US right now of clinicians that are trained and trained effectively and efficiently in this area. We have a health insurance marketplace that does not value behavioral health in the same way that it does physical health. And so, in so many states, reimbursement rates for mental health are egregiously low. And that sets a real deterrent for people to be able to seek and access affordable mental health treatment and care. And for a lot of providers across the US who want to be able to offer their expertise to the perinatal population, it's very difficult for them to survive based on the low reimbursement rates for commercial plans for in-network rates. And then that said, for nonprofit programs and for programs that are available to provide free and low cost services, there's also a dearth of clinicians who are trained in this area, right? So
Mhm.
a lot of OBGYNs and pediatricians across the US who are now being asked to screen more rigorously, which is wonderful. They're also met with this sense of like, but I'm not a mental health professional and I don't have anywhere to send these patients, right? I'm screening a pregnant mom
Mm.
in my office. She is scoring a 23 out of 30 on the Edinburgh postnatal depression scale, which is our standard screening instrument. I know she's struggling. I know she needs help, but all of the places that I generally send my patients to have wait lists that are 3 to 6 months long or are charging rates that are unaffordable, right? So there are a lot of levers that need to be pulled to make treatment in this country more accessible and affordable to people across the socioeconomic divide. So that's one thing that really, really needs to happen. And, one of the things that has been growing as a result is there's been a lot of different types of licenses that have come online. This idea of coaching has really resonated as a more cost-effective way to be able to meet new and expecting mothers where they're at in regards to their mental health. So there is an explosion in looking at the workforce and filling these gaps in different and more innovative ways. Virtual mental health care has really exploded. I think these things are helpful. Where I get concerned is that without proper training, right? When you're dealing with a perinatal patient that has acute mental illness, are people that are kind of entering this field equipped to successfully treat and address that? And so one of the things that we certainly need to keep an eye on, and need to continue prioritizing the accessibility aspect of all of this. You asked me a question in the beginning, which I didn't answer, and I have a tendency to do that because I go off on a tangent, just about the political climate right now and what that has to do, what the backdrop of that is. Well, without being partisan overtly, things were looking quite dire there for a while. I think one of the biggest impacts that we've certainly been talking about publicly here at the Motherhood Center in an effort to be available to every single woman and birthing person, regardless of where they land on the political spectrum, because PMADs do not discriminate, they impact everybody
Mhm.
is but being very truthful and afraid of the mental health implications around all of the abortion regulations that are swirling around. We know through research and science that women who have experienced who don't have access to abortion, right, who have an unplanned pregnancy, that they run the risk of experiencing a PMAD at much higher rates than the rest of the population.
Mm.
And so we know this to be scientifically true. We have reams of data, empirical data to suggest this. So there is a concern, right, of what kind of mental health, behavioral health implications will this have on women that are not able to access reproductive rights in this country? And we are preparing for a flood of that being a direct result and impact. And so, you know, we're in a position where things could look better or not better
Mm.
in the
Yeah.
next 4 years. And I think, a lot of the political will to really focus on this issue has to do with the fact that, again, on a scale from 1 to 100, we've maybe moved the dial to like 5 to 10. Women and birthing people are starting to become ever so slightly more important in some ways, and health and behavioral health are starting to matter just a tiny bit more on the backdrop of everything else that has been happening. And so that in and of itself is helpful. And I think Also perhaps there's been a bit of a backlash against having rights restricted that has contributed to progress in other ways, right? Can I pinpoint that? Definitely. Not sure that I can or that I should. However, I do think that women's health and mental health, as it's being muzzled, it's also growing in other areas, which is why I think we're seeing a lot more attention right now.
Yeah. I'm like swelling with like a little bit of rage right now as we're talking. I'm sorry. And it's my show, so we can be as partisan as we need to be because there's
Okay.
actually like some fundamental human rights involved that some people on this planet and some people in this country think don't exist because of their personal belief systems and religious belief systems. And they're kind of taking those beliefs into people that they don't know or care about and imposing them in ways that are inhumane, I believe. So yeah, we can talk about all that. That's totally fine. It's my show. We can do whatever we want. Um, so having said that, I agree. I feel like when enough people are like, I'm gonna give like stupid analogies because that's what I do. But like if people are standing a lot in line and they're wearing a t-shirt and it's freezing outside, and everyone's standing in line with a t-shirt and it's freezing outside, and somebody keeps like pushing them along with a little stick, and then suddenly they go, okay, now the shirts come off. You're like gonna be like, excuse me, can I have a coat? Because we needed a coat this whole time, and we were living on a shirt, and now we need a coat because don't you dare take that shirt away, and excuse me, we actually need a coat because that's what we deserved this whole time. So that's my stupid analogies because that's what comes to mind immediately.
Perfect.
That's kind of been it, that we've been already not maternal mental health is already, and maternal rights and just female rights and people in this like half of the world's rights have just been diminished. And in this country, sure, we don't get stoned on the street like in other places of the world. That's true. But we also don't need to compare that. And we also need to understand that there is like a level of just knowledge and data, because this is a very data driven, well, we would hope, but for the most part this is a very data driven country, that some data just goes, I don't really care about you in the government, and we need to be like, wait, it exists, let's just like pull it over here and talk about how this is nearly half of the world population, and these things are important to us, so if we want us to scream about it, we will. And I'll say this a million times, but as a person who treats physical health, and I know the mental health and physical health are very intertwined. I talk to my patients about mental health all the time. I don't have any qualifications other than a bachelor's in psychology, so I always refer out. I just talk to them about like mom banter, but that's the extent of it. And then if it gets anywhere that it needs to be referred, we refer. But the point is that the mental health aspect is always more important. And let me tell people why. Um, the OBGYNs in the hospitals, they have like, they're going to get sued if people die on them because they pulled blood weirdly or did something crazy like that. They're going to get sued up their butt and they're going to be in so much trouble. So they really do, for the most part, make sure that medically they're not murdering people in this country for the most part, right? They try their best not to kill people. That's their job. They get in big trouble if they kill people. But the mental health aspect, it doesn't always show up in those like acute, literally life or death ways immediately. However, as much as it is a quality of life problem, it is a life or death problem because of the things that you spoke about earlier today, Paige, right? Like the whole idea of highest mortality rate is, you said, substance abuse and PMADs.
Mental illness, yeah.
Mental illnesses. So the mental illnesses lead literally to death, right? So as a pelvic floor PT who treats pregnancy and postpartum, really cool if you don't piss yourself when you're running to catch the bus, but also really cool if something worse doesn't happen because you have a mental illness, right? So they're all quality of life problems, but I always tell my patients who are suffering with what I believe is something more than just I'm a little sleep deprived and I'm just gonna like sulk a little bit right now in this session. I tell them like we gotta get this in check because this is so much more important than doing the stretch that I gave you. Like, yes, please do the stretch if you can, and please do this, learn how to pick up your baby without breaking your back from the crib because that's really bothering you and it's just contributing to the cycle of like pain and dysfunction. But more than anything, I really think you should go get some help and get some level of support here because that's key to any of this physical recovery piece that we're working on. So it just for listeners, I just want you to know that this country is really weird.
Didn't we just have a vice president who used that same term? Yes, that is not a candidate for vice president.
Yeah.
I so appreciate and honor your rage, and I feel it every single moment of my life. And I am, I'm so appreciative for providers like you, Sneha, who recognize when we're talking about the perinatal population that we look at it through the lens of whole health, right?
Hmm.
And I train a lot of providers out there, and this is a big part of the training is when we're looking at a woman or birthing person in front of you, she is not just a physical composite, right? She also the other half of her has to do with her mental health, and we need to be treating the whole patient at all times. One of the biggest challenges in our medical system, I'm sure that depending on the provider, they would offer a million others, but from where I sit, this being my area of expertise, is that historically, behavioral health for new and expecting mothers has been completely ignored, right? We've allowed this romanticized, glamorized version of motherhood and its blissfulness and amazingness and being a mom is wonderful and like we just don't talk about the fact that we feel like we made a mistake or we're regretful. There was an article in the New York Times today that a dad wrote about feeling parent regret. It's so interesting. My husband was like, this is
Mm.
terrible, what's going to happen when his kid reads it? And I'm like, this is the greatest thing I've ever seen, especially coming from a dad talking about the both and of parenting, and the fact that like some days I love it, and some days I feel like I made the biggest mistake of my life. Like, bring it on. Anyway, I digress. One of the biggest issues in our healthcare system as it pertains to perinatal health overall is that whose job is it to oversee mental health for new and expecting mothers, right? OBGYNs are ensuring that mom's physical health and safety is top of mind, that the gestating fetus's health is top of mind, right? Baby comes out and mom is just thrown off like a candy wrapper from candy, right?
Mm.
Nobody's looking at her, nobody's responsible for her, right? Pediatrician picks up the baton. Pediatrician is all over making sure baby is healthy and cared for and meeting milestones. We do not have an aspect of health care that looks after that new mom, period,
Mm.
particularly not through the lens of mental health. And so nobody sees this as their responsibility. And this is why women fall through the cracks. This is why 80% of all new and expecting mothers do not get diagnosed and do not receive treatment for their PMADs, right? This is why, sadly, tragedies make it into the headlines, right? Of women sadly taking their own life or their children's life, right? This is what falling through the cracks looks like. And this is where the noise is starting to percolate, right? And I think, it's interesting having been somebody who has been one of the loudest in holding OBGYNs accountable for screening, and saying for years and years, you're the one to do this because you're the one who's seeing this patient during their perinatal period more than anyone else, right? So I fundamentally believe that there should be routine screenings and psychoeducation provided at every visit. Sorry if that's too much, at every visit. And there's all kinds of things I could say about how to screen. It's not just giving somebody the EPDS and asking them to fill it out and maybe talking to them about it or not, right? Like there's a whole process in how you actually screen effectively.
Mhm.
Um, and so it does fall on that of the OBGYN. And I will also say every other provider that comes in contact with a new or expecting mother. Now, fast forward, I also can understand where OBGYNs are coming from. They are not trained in mental health, right? They are often unsure about what to do with somebody who is right in front of them that is struggling. Where do I send them, right? To the same things I said before. I don't know where to send them. The wait lists are 3 to 6 months. I don't know where to send them that's affordable, right? So it's again in honor of the both and it is this like, yes, it's your job. And also, this is a difficult place for you to be in because
Hmm.
you haven't been properly trained in this area. So one
Hmm.
of the models that's emerging that I think is brilliant, and we're starting to see percolate a little bit of interest again on different governmental levels, is this collaborative care model, right? Where in OBGYN settings, in midwifery settings, hasn't quite crept over to pediatric settings, but they're next. We have a patient care navigator, right? This could be a social worker that whose role is to provide in an OBGYN's office psychoeducation around maternal mental health, routine screening, right? Going over the results with the patient and explaining to them what this means, providing what we call a warm handoff, right? So, not just handing a patient, oh, here's a piece of paper that's been copied over 700 times that's almost impossible to read with like resources to help you if you're suffering from postpartum depression that places that aren't even open anymore. But like a warm handoff means I am going to call the provider with you and make this appointment with you and then follow up and make sure that you went, right? I'm going to case manage you so that you get to where you need to go to feel better. Somebody who can offer short term therapy, right? As a bridge until they are connected to ongoing outpatient care or a higher level of care. Somebody who can run support groups, right? Again, as an option, it might be all that a new or expecting mom needs, or again, a bridge until they're connected to the care that they need in an ongoing way. This collaborative care model is a beautiful thing, but it needs to be funded. It needs to be a priority, and there needs to be financing available where OBGYN practices and hospitals can create these staff lines and create these patterns of care. But it's these kinds of models that we're finally starting to capture more and more attention. But as most things, right? An idea is great, almost always needs some money put behind it so that it can actually work and do what it's intended to do.
Hmm. And then maybe we can eventually add that the social worker, there's like questionnaires for pelvic floor dysfunction and physical
Exactly.
ailments
Whole
because
health, Sneha, whole health,
we
all of it.
literally had the number of patients that come up to me with like debilitating pubic symphysis dysfunction, sacroiliac dysfunction, coccydynia, or even just like neck pain and like other kinds of things because of the pregnancy. It's induced from the foot pain, or serious pelvic floor issues where they're like in so much pain they can barely walk, and the doctor's like their OB is usually like, this is just pregnancy induced, it'll go away. And they're suffering. And it's like, why do people have to suffer? We have solutions for this. We have ways we can mitigate this. But
100%.
anyways, that's on the whole physical health aspect. And there's obviously pelvic floor PTs exist for a reason. We literally specialize in this. This is what we do every single day. So it'd be really nice to have this collaborative care option. And really the OBs are the gatekeepers there. And that's I talked to all my pelvic floor colleagues as well who treat, and we're always talking about how so many of our patients come in being dismissive, but their symptoms being dismissed for so long, and sometimes they just never get care, and then they come postpartum when it's like blown out of proportion. But anyways, that is a beautiful idea. And I want listeners to know where they can find you so that they can come to you guys if they're experiencing these things, if they feel like somebody they know needs help, um, or if they feel like they want to join your cause because, like, this is an amazing cause. Yeah.
Well, thank you for that. And I'm surprised I didn't mention this, but I'm going to mention it now. You know, research supports that 1 in 5 new and expecting mothers and birthing people experience a perinatal mood and anxiety disorder. We who do this work know it's much higher than that. It's more like 1 in 3. But again, because 80% of all cases go undiagnosed and untreated, there's an enormous amount of birthing people out there that are not getting diagnosed or connected to the care they need and deserve. And I share this because PMADs are very, very prevalent. And whether you are a new or expecting mother or birthing person that is struggling with depressive or anxious symptoms, or you are a friend or family member to somebody who is expecting or newly postpartum, and you're noticing that they're struggling, right? That there are places that people can go to get better. And as I mentioned in the beginning of our conversation, the Motherhood Center exists to provide these supportive and clinical treatment options to people that are struggling, whether they need a support group to be around other new and expecting moms that are having a difficult time and need the experience of having their thoughts and feelings normalized or given permission to have their thoughts and feelings. We offer support groups for people who are struggling. We have therapy, medication management, the day program. And we also offer the majority of our treatment virtually. So for people as we know, it's very difficult for new and expecting moms and birthing people to get outside of the house because they're caring for one or more children. All of our outpatient treatment is virtual, and about half of our participants in the day program join us virtually. The other half come in person, and support groups are virtual. So care is more accessible now than it ever has been before. And if for some reason somebody is looking for treatment and we're not a good fit, we have a long list of providers that will be, whether it's cost or it's geography or whatever it might be. We are committed to treating patients, and if we're not the best fit, we make sure that every single person is delivered to the best fit so that they can get the support and care that they need. And people can find us online. They can visit our website at www.themotherhoodcenter.com. We have a website for new and expecting moms to learn all about what we do. They can fill out an online inquiry form, and one of our care coordinators will call them back to conduct a screen and get a better sense of what their symptoms are. And we also have a provider website. So providers can go straight on there, fill out a provider referral form, and we will call that patient back within a couple of hours upon receipt. So these are different ways, or people can just give us a call on the main line. But what I want to say, Sneha, one of the things that I appreciate so much about you is you are a unicorn in the sense that you recognize this concept of whole health, and that women and birthing people are comprised of physical parts and psychological parts, and we need to look at it all together. And you have taken it on as a provider to recognize that and acknowledge that and make yourself familiar with the resources that are out there. You are helping to destigmatize and normalize how common these diagnoses and illnesses are for new and expecting mothers. And I wish I could clone you because we are far from a world where every single provider who comes in contact with a new or expecting mother recognizes the responsibility of talking about maternal mental health. Because as I said, we do not have that designation. And so everybody needs to be looking, talking, screening, referring. And that is how we save lives. That is how we, as a community of providers who take care of the perinatal population, really ensure their safety, and that they're getting everything that they need to be successful mothers and parents, right? Which is really what everybody deserves.
I love that so much. I will drop all the information for you guys in the show notes. Anybody who's listening, even if you're just thinking about getting pregnant, if you're like in the conception phase or you know somebody who's looking into getting pregnant, it's never too early to start thinking about this, not to scare people, but it is really important. I honestly, and this is just on a personal note, and this could be true or not true, I'm not really sure, but I feel like the number of times I've come into contact with professionals who serve, like who serve perinatal mood disorders, the conversations that you and I have had so many times years ago, and just talking to patients about just being in that network. I personally feel like that was probably one of the few reasons that I didn't get in a sticky space when I was pregnant and postpartum. And the reason is because I was able to understand how common this was, destigmatize it for myself, told my husband all about it, and was aware of it. I was constantly like, am I doing okay today? Is everything okay? All right, cool, Sneha, we can move on. Like we can go and eat our baby's cheeks and just snuggle up and have the best day ever. And anytime I wasn't feeling like the best of myself, I was like, is this just me being like, I only slept for 2 hours non-consecutively yesterday night? And am I just hungry right now? Or am I starting to get really sad about this whole situation and having not the support that I thought that was going to happen? And so I think that was really important for me. And that was what like helped me get out of it, even if I was starting to slip into like getting sad or anxious about anything. I'm so grateful for the work that you guys do. I will drop all of that stuff in the show notes. For listeners, I really hope anybody who is struggling gets help. It's out there, and even if you don't live in New York City, in this state, if you reach out to the Motherhood Center, they might even be able to get you in touch with somebody in a different state. Because I know that this is a national and international audience. Or you can reach out to your local mental health serving spaces, I guess, serving bodies, and then ask for these services. America really sucks with this stuff, but other countries are actually so much better. So hopefully you live in one of those countries, honestly. Thank you so much, Paige. I hope it doesn't take 4 years to do this again, but if it does, we have so many exciting things to talk about, hopefully.
Oh my gosh, can you imagine 4 years from now? 4 years from now, Sneha, there will be, let's just put it out there, right? Let's
Yeah.
try to make it happen. There's going to be in every city, this is best case scenario, there's going to be perinatal centers where people can go preconception that are just getting ready to get pregnant, where they are taught about maternal mental health. They are taught about parenting. They are connected with acupuncturists and pelvic floor specialists and OBGYNs and midwives and behavioral health, and it's all in one place. And these are supports that follow a perinatal person from preconception all the way past 1 year postpartum and make sure that whole health is accessible all in one place and that mothers and birthing people are cared for as they need and deserve to be so that we can start to eliminate all of these unfair statistics that float around as it comes, as it pertains to birth. Anyway, we can dream. We'll see if we're there in 4 years. But even if we're not, we'll be able to talk about what's happened since this conversation.
Oh, absolutely. I'm looking forward to that. And I'm willing that into the universe to manifest.
Me too.
Thank you, Paige. Thank you so much for all that you do.
Thank you, Sneha, for having me. And yeah, thanks to all your listeners to being interested in this topic.